Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. If your child has a minor injury or an illness that arises when your primary care doctor is unavailable, you could go to a pediatric emergency department at a hospital, or you could go to an urgent care center for children. How do you know which is best? I'll talk about that with Dr. Phil Mackewicz. He specializes in pediatric emergency medicine at Upstate, and he's the medical director for the Upstate Golisano Pediatric After Hours Care. Welcome to the Informed Patient, Dr. Mackewicz.
Hi, thank you for having me.
The Golisano Pediatric After Hours Care, I know it's for birth through age 21. Can you give us the particulars about locations and hours?
Sure, absolutely. So, like you said, we're a pediatric specific after hours care. We are currently going to be located at the Nappi Center on the fourth floor in the same location as the University Pediatrics and Adolescent Center. So when you come through the hospital, you can park in one of the main garages and then come right over the bridge right to our clinic. We're there from 4 to 11 on the weeknights, and we're there from 12 to 9 on the weekends. We stop accepting new patients during the weekdays at 10 p.m. and we stop accepting new patients on the weekends at 8.
Okay. Do you need an appointment or do you need to call ahead if you're planning to come?
Absolutely not. We love accepting walk-ins. That's our main game that we play is we're there when your pediatrician isn't. So we expect that you guys will just walk in and you'll come to us and, Jemmy has a sore throat or a runny nose and we're happy to see you that same day. No appointment necessary.
Do you need to have health insurance?
You don't. You can come in and everything that requires payment after the fact will happen after the fact. We're happy to see you regardless of if you have insurance or not. And we also are happy to see you no matter what type of insurance you have if you do have insurance.
So this sounds like it's ideal for someone who's visiting from out of town because they're nowhere near their primary care provider. And if their child becomes sick or injured, this seems like an ideal place to bring them.
Yeah, absolutely. I've had plenty of patients come through already and they're saying, oh yeah, we're visiting from out of town. My son has a cough and I just wanted to get it checked out before we get back on a plane. And we're happy to see them. And no matter who your primary care is, we'll still get the information from that visit to them in some degree or another.
Now, what are the wait times like? And I know that's going to vary, but in general, what are the wait times like?
Yeah, we try to pride ourselves on pretty short wait times. Obviously, as you alluded to, it can vary based on the time of the year, school year being much busier than, during the summer. But generally, wait times can be as short as 15 minutes. Sometimes you can get in and out within 20 minutes. Sometimes we do have longer wait times of about 45 minutes, but it all completely varies. But we try to be pretty quick about it.
So tell me if the concept of triage people may or may not be familiar with. Do you use triage there at the after hours care?
Yeah, so we have a nurse who does our triage for us as soon as you get checked in and get into the triage room. And they decide whether somebody needs immediate care or immediate intervention by a physician or a practitioner. And if they do, they will immediately bring that patient back so that one of us can take care of them. If not, sometimes they'll have to go back into the waiting room after triage is done, but we do have a triage nurse who's there doing all of the things that the triage nurses do so well.
So the most crucial medical issues are dealt with ahead of time. So a person who comes in, you don't take them as in order as how they arrive. You take them in order of importance of what needs to be fixed first.
Most often, yes. I will say that we really only have 2 triage levels at our acute care facility. So whether they're emergent or whether they're urgent. And if they're in emergent care, they do get to jump the line and get seen sooner. If they're urgent, they'll get seen in the order of which they arrive.
Now, you said people can park in one of the garages downtown across from the hospital. Is there a charge for parking?
As of right now, there is going to be no charge for parking. We are going to validate our patients' parking passes so that they should get a discounted rate to hopefully $0 so that they don't have to pay anything when they leave.
Okay, can you talk to me about how the Golisano Pediatric After Hours Care differs from a regular urgent care center? Because I think we're used to seeing an urgent care center in our neighborhoods in the suburbs.
Yeah, so there's a lot of urgent cares kind of popping up here and there. And what makes us so special and so different is that we are a pediatric specific urgent care. So kind of as you said earlier, we see only children ages 0 to 21 years, but in the same capacity, we're all pediatric trained physicians and nurses. So I did my care or my training in pediatric emergency medicine. So I specialize in just taking care of little ones in the emergency room. We have a lot of pediatric specialists as well who work in our urgent care, and we are well attuned to pediatric medicine as opposed to urgent cares, which generally you see a practitioner who has a very wide scope of patient expertise, not as much narrowed as we are.
Now, how does it differ from a hospital emergency department or a pediatric hospital emergency department?
Absolutely. So we differ in the sense of what we see and what we're comfortable seeing. In an emergency room, it's going to be busy. People are going to jump the line all the time because more emergent cases will come in, whether it be a car accident, a seizure, an ingestion. Those are all things that are going to supersede somebody who's coming in for a cough or a runny nose. Whereas we are going to see these kids, as we mentioned earlier, in order. We'll see them when they come in for a cough and a runny nose and hopefully get them out a little bit quicker. So the wait times are definitely going to be different for us. We also tend to deal with the less emergent cases as opposed to an emergency department.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Phil Mackewicz. He's the medical director of Upstate's Golisano Pediatric After Hours Care. And we're talking about how to decide between a hospital or an after hours care or a phone call to a primary care doctor. So let's go over how parents can decide, do they need to call 911 or can they come to after hours care, assuming that it's at a time when their primary care provider is unavailable. So what situations would you say always need to go to the hospital?
The things that I always immediately think of in terms of what needs an emergency level care, any sort of seizure like activity needs to go to an emergency room. They need to be seen, they need to be monitored, they need to make sure things don't worsen before they get better. One specific example as it pertains to pediatrics are fevers in children that are less than 2 months of age. This is crucial because these kids are extremely susceptible to infections and they need extensive monitoring, extensive blood work and testing to make sure that there is nothing serious going on for them. Any sort of trauma that's severe, whether it be a car accident, an ATV accident, a severe sports injury, those all need to go to the emergency department where they can see any specialist that they need to see. For me, I think those are the big three that I always think of in terms of what needs to go to the emergency department and what needs to be seen more critically.
And then what situations would you say are appropriate for after hours care? And before you say minor illness or injury, how do you define minor illness and injury?
Yeah, minor is such a hard word to say when it comes to like minor injuries because my minor injury is different than somebody else's minor injury. I think if you have somebody, like if we use injuries as an example, if you have a child that, is playing at a trampoline park, which I love because they keep me in business, and they have a broken bone or something, and the broken bone that you're worried about isn't what we call angulated or kind of deformed, meaning that you don't see an extra angle in their child's arm or leg that isn't supposed to be there. I'm happy to see those. We have x-ray capabilities, we have lab capabilities, we have all of that we can do there. If they need to see an orthopedic surgeon more acutely or an orthopedic doctor more acutely, we have the ability to transfer right over to the emergency department so you can see them more acutely. But we can start everything with you there. When it comes to lacerations, if you have a small laceration, meaning something that's less than 5 centimeters and it's more like a straight line or what we call linear in the field, we're happy to see those in the pediatric after hours care. Anything that's more complex than that, meaning it looks more of like a star or we call stellate, or it's got complex layers to it, or it's super deep, those are happy to be seen in the emergency department. And then in terms of like illnesses, which is a very broad category, anything that's like a simple URI or an upper respiratory infection, cough, congestion, runny nose, fevers for a couple of days, sore throat, happy to be seen at the acute care at pediatric after hours.
So, what happens if a parent brings their child to the after hours care and you determine they need to have blood drawn or they need x rays? Do you have that ability right there?
We do it all there. Everything happens at this visit. So what we have is the ability for the nurses to come in and draw the blood. We send the blood over to the lab, and we as the provider will get those results in real time. You don't have to wait 2 days for the blood work to come back. We get that result and we tell you that result at that moment. Granted, there's going to be some lag time with the lab actually running the samples, but we will tell you at that visit. In terms of x-rays, ultrasounds, anything of that nature, the patient will get brought down to a radiology suite where the ultrasound or the x-ray will get done. And then they will come back to our department. We will get those results. We will review those images. We will discuss everything with the family and with the patient.
And then what happens if the child needs to be admitted to the hospital? Can you do that more quickly because I think you're actually attached to the hospital building, but you're right there.
Yeah, so it's really cool because we are like right there. We're like in a stone's throw of the hospital. So we do have the ability to admit. There is going to be a little bit of a process that goes on behind the scenes with that. And we try to explain this to the parents as best as we can when we do have to admit. The things we typically will admit for from our after hours clinic are usually the most I admit are dehydration and asthma exacerbations or worsening of your asthma. Those are the two that I usually admit from there, but we do have the ability to do that.
What if you prescribe something for the patient to take, a prescription they need when they go home, but it's after hours and the pharmacies are closed?
This is one of the coolest parts about our clinic being open over at the Nappi Center is we have done all of this in conjunction with our pharmacy department so that our outpatient pharmacy is going to be open for as long as we are. So say Jimmy comes in, he's got an ear infection and he needs an antibiotic to go home with. We will send that to the pharmacy, which is on the first floor of our building. Parents can go down, grab that prescription before they go back to their car, and they are physically leaving our facility with the prescription in hand.
That is handy.
Yeah.
Now, I don't know if I asked you, do you provide sports physicals or vaccines?
The sports physicals we generally do not do. And the reason why we don't do those is because those should be done by your primary care provider because they know you best. They know your child best. So they should be the ones to know what the baseline is. I only see your child for a snapshot of a time. I want that to be performed by somebody who knows your child much better than I do. When it comes to vaccines, that is a kind of a more complex question to answer. The normal childhood vaccines we do not offer in our clinic. So if you need an update on your hepatitis B titer or a hepatitis B vaccine, or you need something of that nature, we are unable to provide that at this particular moment. That could come in the future. We don't know yet. But if you are one of the unfortunate people that get exposed to an animal that maybe could be a rabies precaution, we're happy to provide that there. We're actually one of the sites in the Syracuse area that actually do a lot of rabies vaccinations and rabies clearance. And those are cleared by the Onondaga Health Department, and we know about you coming. So we can provide those vaccinations, but normal childhood vaccines, we don't do quite yet.
That makes sense. Now, do you have some advice for parents about what to do in the heat of the moment? Because when your child is hurting or sick, it can be very stressful for the parent. And especially if your regular doctor's not available, what can they do to help themselves calm down and assess the situation?
Yeah, and this is so nuanced and it's so difficult to do. And it's so easy for me to say, take a breath, do all these things. It's so hard to do this when it's your own child. So I think the most important thing is it truthfully is just to try to take a deep breath and just make sure that your child is physically okay to the point that you don't need to call 911. If you have anything in your gut as a mom or a dad that you say, something's not right and I need him to be seen very quickly, please call 911. We have wonderful paramedics in the area that are able to come by and assess your child and say, this is what we think is going on, and we can bring you to an emergency room if we feel like it's necessary. If you take a step back and you see that your child is doing okay, meaning that their breathing is okay, they look like they're responding well to you, they're not what we call altered, meaning that they're not at their baseline, then we're happy to see them at after hours care. So I would say just bring them to us and we are happy to assess them. Because what I don't want people to do is think their child is okay and then something happens down the line and you're beating yourself up as a parent. I would rather see 1,000 healthy kids just for concerned parents rather than seeing one child that is seen now too late that we're now backpedaling from. The other option is always calling your primary care office. There are so many offices in the community that have a triage line, and we have a triage line through Upstate as well that you can call, and they are able to give you advice over the phone about where they feel that your child needs to be seen. It's 315-464-8668. And that is a number that they can call. They will talk to most often a nurse, and the nurse will go through a history with them. They'll ask some very key questions and then defer the patient to the right level of care.
Well, this has been very enlightening. Thank you so much for telling us about pediatric after hours care.
Of course. Thank you so much for having me. This was great.
My guest has been Dr. Phil Mackewicz, who specializes in pediatric emergency medicine at Upstate and who is the medical director for Upstate Golisano Pediatric After Hours Care. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.